You have a cat for us today about Kristen, your patient with asthma?
Yeah, I do actually. I found this good article up in the library, and I'll give you guys copies of the cat here. The article is titled "The Effect of a Peak Flow-Based Action Plan in the Prevention of Exacerbations of Asthma." So kind of exactly what we're looking for. The lead author's name is Cowie, and I think it answers that question that we were trying to look at before. The study is a single-blinded, concealed, randomized control trial with intention to treat, all good things that we're looking for. And I just have to explain a little bit about the number of patients that they used, because it's a little bit difficult to follow, but there were 150 adolescents and adults that were followed in this study, and they looked at both ER visits and hospitalizations for acute asthma attacks or exacerbations. There were really three groups in the study. The first group got a peak flow action plan when they went to the emergency room, and they followed what happened to them afterwards. Then the next group got a symptom-based action plan, and then the final group had no intervention in terms of an action plan, but did receive the same educational, asthma education that the other two groups got. When they looked at the results, the numbers of hospitalizations and ER visits in both of those groups, I think about 6 months out was how far they followed them. There really wasn't a significant difference between both the symptom-based action plan and the no intervention group. So what we did in order to get the numbers that we have here in the CAT, we condensed those two groups together. So does that kind of make sense?
Yeah, that sounds great.
So our outcome was urgent treatment or ER visits for asthma exacerbations, and we looked at 6 months. We followed them for 6 months. So our control event rate was 0.33 or 33%. Our experimental event rate was 0.1 or 10%. And then basically what we then can do is calculate a relative risk reduction, which tells us, that number is 70%. So basically what that tells us is that our intervention of giving people a peak flow action plan is going to reduce their trips to the emergency room by 70%. We then calculated something called the absolute risk reduction, and that enables us to calculate another number called the number needed to treat. That number works out at 4. That's really an important thing because that tells us that we only need to treat 4 people or give them a peak flow action plan in order to make a difference in one person coming into the emergency room. So I think that's kind of as far as I got.
Oh, that sounds great.
Yeah?
I think that we can apply this nicely to Kristen. Fred, do you agree?
Yeah, I know we've given her a peak flow meter in the past when we've seen her in the clinic for her asthma, but I don't know if we've clearly set up an action plan. But that's something we could easily do, kind of go through her different zones based on her peak flow and set her up with that. And that'll help her to know when she needs to increase her quick relief medication, her albuterol and or add oral steroids, or come to the emergency room if she's sick enough. So I think that's something we could easily do and potentially avoid some of these visits like we had last night.
Great. I think that sounds good. I think, Alexa, this data that you found is great. This may be something that we should apply to all of our asthmatics that are admitted here to the inpatient unit to try to help them in the future with their asthma exacerbations.
Yeah. At the very least, we should do the asthma education part.
Absolutely.
Yeah.
Great. So, Fred, could you call Mrs. Poulin and let her know what we talked about today?
Yep, I can give her a call this afternoon.
Okay, thank you.